Our integrated community services put patients and their families at the heart of everything that we do. Our aim is to provide the best possible care for the population needs of Knowsley. To support these needs, we have primary care centres, urgent treatment centres, secondary care local hospitals, leisure centres, and one specialist heart and chest hospital. In collaboration with Knowsley Clinical Commissioning Group and other local NHS providers, we've developed a tailored approach to caring for our patients with cardiovascular and respiratory needs. We call this the Knowsley Model. Let's take a look at how it works.
Sandra is 48 years old and married with 2 grown-up children. She works in a local factory and has smoked roughly 20 cigarettes a day since her late teens.
I'd not been feeling great for a few months and breathing seemed to be getting harder, especially when going up the stairs. The dry cough which I'd had for 2 or 3 years just wouldn't go away and it was getting me down. My family persuaded me to go to the doctors. She said that she was going to refer me to the respiratory clinic, which was just up the road from where I live. At the clinic, a member of the team gave me some breathing tests and told me I would need to come back for another appointment in approximately 10 days. When I went back, I met a really nice consultant who told me that she'd seen my test results, and after taking a detailed history from me, she confirmed that I had chronic lung disease. She explained what smoking was doing to my health and advised me to stop, and she also asked me to start some inhalers which would help my symptoms. The inhalers seemed to help a bit, and then about 3 weeks later, I got really breathless and struggled to breathe. The cough was now producing some pretty nasty green stuff off my chest as well. I dug out the keyring that I'd been given at the last appointment and spoke to a lovely man at the admin hub. Less than an hour later, a physiotherapist arrived at my house. He introduced himself and asked some questions and then examined me. After listening to my chest, he diagnosed me with a chest infection. He supplied me with a course of antibiotics and steroids. This was really helpful as it meant I could start the treatment immediately and didn't have to wait for the chemist to open the following morning. He also gave me a nebulizer as my inhalers weren't as effective as normal. During the consultation, I felt able to open up to the physiotherapist about some of the stresses in my home life. After talking these through, he asked me if I would like to see the team counsellor. I agreed and an appointment was arranged for the following day. After speaking with all the team and taking my medication, I definitely started to feel better and my breathing improved. I had regular visits from the nurses and physiotherapists, and after a few days I was well enough to be discharged back to primary care. The nurse said that she would inform my GP about my diagnosis and the treatment I'd had and gave me a standby rescue pack for me to keep at home. A week followed and I had a call from the admin centre who wanted to arrange an assessment for pulmonary rehabilitation, and just 4 weeks later I was enlisted onto an exercise and education programme in my local community centre. The respiratory service has really helped me and they have given me a new lease of life. Hopefully I won't need their help again, but if I do, I know how to contact them.
Bob is a 78-year-old retired engineer. He has 1 son and lives alone in a bungalow. His wife died 2 years ago. He is normally fit and well, has good support from his son, and is very independent, and likes to go on holiday abroad twice a year.
Having always been fit and well, I started to get worried that I was getting really puffed out and my ankles were swelling up like balloons. I could feel my heart pounding and racing. My son persuaded me to go and see my doctor, who examined me and said that he thought that I had a heart murmur and made me an appointment to see a cardiologist the next week. Imagine my surprise when I discovered that the cardiologist actually held his clinic right here in my GP practice. The cardiologist said the patient got to see the right professional closer to home rather than wait weeks for the different appointments. When I arrived with my son at the community clinic the next week, I was a bit apprehensive, but was immediately put at ease by the cardiac physiologist. She talked to me and ran through some tests on my heart, including the ECG and an echocardiograph. After these tests, I went into my appointment with the cardiologist, who already had my results, and explained that I was going to need an operation on my heart. The consultant said that I could start my medication at home and the community cardiac nurse would visit me to monitor how I was doing. The very next day, a nurse called Sharon rang me and said that she would come to see me later that day. Sharon came to see me once a week whilst the tablets were being increased. Sharon also arranged for my pre-op assessments, and when I went to Liverpool Heart and Chest Hospital, I was met by a member of the nursing team and the cardiac surgeon himself, who took time to explain why I needed the surgery using a diagram and models to explain what the problem was. After my surgery, the nurse had a good chat with me about what I should and shouldn't be doing and told me that the community team would be informed that my surgery had gone well. When I got back home, Sharon came to see me and said that she was really pleased with my recovery, but that she would check in regularly to check how I was doing. I felt that my health had improved and my breathing got a lot better. Sharon arranged for me to attend a local cardiac rehabilitation class, which helped me to build up my confidence, and now I'm looking forward to booking a holiday in the sun next year.
Recognised by the Care Quality Commission as outstanding, we have been delivering specialist cardiac and respiratory community services in the Borough of Knowsley since 2010. Each year there are over 29,000 community appointments. Of these, 9,000 are new patients and are seen by a consultant within 10 working days. 85% of our patients complete the joint cardiopulmonary rehabilitation programme, which is much higher than the national average. 100% of our patients requiring rapid response home visits are seen in less than 2 hours, avoiding hospital admission. By placing our respiratory staff in accident and emergency departments, we have seen a 13% reduction in unnecessary hospital admissions. We are proud of our friends and family test feedback, reporting 99% of patients rating our services as outstanding. If you'd like to know more about our integrated care models, please email us at communications@lhch.nhs.uk.